So like we were discussing, gallstones are extremely common in our general population. A lot of patients may have, during a general health checkup or a scan for some other problem, like in women for a gynecological problem, you go for an ultrasound, the ultrasound picks up gallstones. So what do you do with these patients? So if the patient has not had any symptoms, the patient, especially over 30 patient, has no symptoms whatsoever, he never had any pain abdomen in his entire life. In these kind of patients, asymptomatic gallstones may remain asymptomatic for prolonged years. Studies have shown that patients with gallstones with no symptoms may remain without symptoms for 30, 40 years. So in these patients, treatment is not mandatory. We can choose to just observe the patient and do the treatment for gallstones only when the symptoms occur. But if you have a single episode of symptoms, like even if you had a single episode of pain related to gallstones, let's say not 6 months back, but 2 years back or 5 years back even, once you have a single episode of gallstones, you become symptomatic gallstones. And the symptomatic gallstone patients are at a risk of complications like acute pancreatitis, cholangitis, gallbladder rupture, and gallbladder infection. The incidence of these complications is 4 to 8% per year. That means in the next, every patient with symptoms will have these serious complications within the next 10 to 12 years. Likewise, in younger patients, like in young children, sometimes because of blood disorders and some other factors, they may form gallstones. In these patients, when you're very young, like less than 25, and you have gallstones, the likelihood of you developing symptoms and complications in the rest of your life is very high. So in younger patients, we prefer to do the treatment.